All right, welcome. Here is our first audio lecture on Chapter 1. And Chapter 1 is important because it goes through the word building rules and gives us an idea on pronunciation and how to put these words together, some of the rules that revolve around it, and then how to peel them apart. Okay, so this really sets our foundation. Okay. And so success in this program really does depend upon getting these word elements or these word parts. I hate to use the word memorized, but really ingraining these into your brain so that as you go through, it really will make it easier to decipher and peel these words apart. Okay, and so there are some specific rules as far as combining these words together, and that's what this chapter is going to go through. Okay, so let's go some of the word elements themselves. The first thing we'll talk about is the word root. And the word root tends to have a lot of Latin origin, and so some of these words you'll see both in even the French language and Spanish as well. So the word root is considered the basic foundation of a word. That basic foundation, those components, you have different components that can actually be added to the word root that actually change the meaning of the full word. The word root itself always stays the same, but you can add suffixes to the end or a prefix to the beginning, and it kind of changes the meaning of the overall word. So the first example that they give us here is Cardi. So Cardi, we kind of use this all through this particular PowerPoint, but Cardi is a word root, okay, and it means heart, and it will always mean heart. And you can add words, you can add elements to the end or the beginning of the word that can actually change what the overall meaning of that root word is. So here we have cardiologist. So cardi is our word root. Ologist means one who studies or a specialist in a field of. And so when you put this word together, you have a cardiologist, which is a specialist in the area of the heart. Okay. Now, when we have this word root, oftentimes we need a way to connect that initial term with another element at the end to kind of complete it. Okay, so here, and to do that, we have to actually add some form of a vowel oftentimes. And so there's times where we have a word root, and then we have to combine it with a vowel. And if that happens, then we create something called a combining form. Okay. So by itself, the word root is just that word element, but when you add a vowel to it, that changes the term, it becomes a combining form. Now that vowel that we use to combine word elements together is usually an O. The overwhelming majority of the time it's an O, but every once in a while there's a couple of exceptions and you'll actually see an I, okay? And those combining vowels allow that word part or that word to actually be joined together grammatically correct. Now there are times in some words where you actually have more than one word root. Okay, so if you combine 2 or 3 word roots together, then it actually becomes something called a compound word. Compound means more than one. And so it's important to realize that these combining vowels are going to be needed to be added if we have those word roots together to combine them together, okay? Regardless of whether that element that we're adding begins with a vowel or not, okay? So here is an example, the word myoelectric. So if we break that down, we notice that we have 2 word roots here. My or myo, my means muscle. Electric means referring to electricity. Okay, so in this particular word, if we kind of chop it up the way they have there, my means muscle. The combining vowel is going to be needed between my and electric in order to combine it together. So that word would be myoelect. Okay, so you need that combining vowel in between those 2 word roots to bring it together. Okay, but now what we'll find as we go a little bit farther is that when we put this suffix on it, IC means pertaining to. And so when you put that on the end of elector, you don't have to have that combining vowel there because this particular suffix starts with a vowel, okay? And so the word becomes myoelectric, okay? You have your word root here, your combining vowel, and what that will give you right here is called a combining form. If you have my by itself, it's a word root. This is our combining vowel, and then when you put the two together, you get a combining form. Another important rule is that a word can't end in a combining form, okay? You can't just end that, you can't end something in a combining form. And so we have the end of a word is called a suffix. And so all forms or all words are going to have a suffix at the end of it. You can't leave that combining form by itself. Sometimes when you add that suffix, what it does is it makes that word either a noun or an adjective. Remember, a noun is a person, place, or thing, and an adjective is something that describes something, okay? When we use this word megalocardia, this isn't my favorite word to demonstrate with, but the example here is we have two word roots. We have megalo and then we have cardi. So cardi is heart. Megalo is kind of a weird word element because it can be used as a suffix as well as a word root. But here you have to have the O to connect them together. So this is our connecting O here that has to be there, the combining vowel. But this word can't be megalocardi or megalocardio because you're ending in a combined form. Okay, and so adding this A here makes this word a noun and adds that A there. So megalocardia is a condition where the heart is enlarged. Okay. All right, so this just kind of says what I was saying there. You have to have that, you have to have your combining vowel here between the two word roots, but you can't end it here. You have to put some sort of a suffix or an A or an E at the end to actually make this word a noun. Okay, and so in the case of this, what they've done is add an A, and that makes this word a noun and doesn't leave it dangling with two combining forms placed together. Okay. There's got to be some sort of suffix ending here. Okay, so a question. I know I just said a lot. So true or false, the word root is the basic ending of a word. Okay, and so remember the word root is the basic component of a word. Okay, and not the ending of a word. We'll talk about the ending, which is a suffix, in just a little bit. Okay, so it's the basic component or basic foundation of a word. Okay, so what do we have to do if a term has more than one word root? Okay, so what do? We talked about that. If we have a word root and we have a second one that we're adding to it, then what do we have to do to combine those two together? We need that combining vowel. Remember the example of that was myoelectric. Okay, usually that combining vowel is an O, but once again, every once in a while, you'll find an exception and there's an I used. So here's the word suffix. So we kind of talked about that already. A suffix is a word element that goes at the end of a word root, and that adding that suffix makes the word either a noun or an adjective. The meaning of that suffix remains the same, just as the word root does, but when you combine the two together, it can actually change the overall meaning of the word itself. Okay. Now, when we attach these suffixes, there is a rule how we add these, okay? If the suffix begins with a vowel, A, E, I, O, U, and then sometimes Y, then that root will attach, then the suffix will attach directly to the root, okay? But if that suffix begins with a consonant, so any other letter besides that, then we're going to need that combining vowel. That's why that combining vowel is there and why it's important. We need it if we're going to combine two word roots together, but we also need it if we're going to add a suffix and that suffix begins with a consonant. Okay, and we'll see a couple of examples of this as we go through. Okay, so here's an exam where we're adding, or an example where we're adding a suffix to a word root. So once again, we're using cardi. That's our word root, which means heart. Now, the suffix that we're going to add is gram. So gram is sort of a recording of the heart, okay, or some sort of a record of the heart. And so here, gram begins with a consonant. So here's a case scenario where we have to add the combining vowel O. It wouldn't be cardiogram, it's cardiogram, because gram starts with a suffix or starts with a consonant. Then we have to have the combining vowel to grammatically correctly put these two words together. Okay, so the combining vowel is necessary. Now, here we have a different suffix. We have our same word root, but then we have a suffix algia. Now, algia means pain. So when we put these two together, we're referring to pain of the heart. Okay, but because algia begins with an A, we don't need the combining vowel. We have cardi. It isn't cardioalgia. Okay, we drop the O and just put the two together. So here, because our suffix begins with a vowel, we don't need the combining vowel. Okay. All right, so here's a question, and I don't want you to get confused because sometimes this could be a little bit confusing. So we have the word hypodermic, okay? And the question is, why is there no combining vowel before the suffix? Now, what I don't want you to get confused with is the word hypo, okay? Our word root here is derm. So derm means skin, okay? The word hypo is a prefix. That is a word element that goes in front of the word root, okay? That is not our combining vowel right there. So when we're actually looking at this, our word root that we're looking at is derm, okay? And our suffix here is IC, which means pertaining to, okay? So the reason why we don't have an O here between those two is because the suffix begins with an I, okay? Over here we have hypo. Hypo means below or under, and so this word actually means pertaining to, below the skin, all right? But this O here is not a combining vowel because all four of these letters are an actual prefix, okay? All right, so the suffix IC already begins with a vowel, so no combining vowel is needed. All right, so let's talk about the prefix. Pre means in front of or before, okay? So prefix is a word element that attaches to the beginning of a word, all right? And just like the other word elements, the definition always remains the same, but when you add that word to it, it can change the overall meaning of the whole word, okay? It is important to note that not every word will have a prefix, okay? All words have a word root and a suffix, but not every word has a prefix, and so that's okay. It's just one of the exceptions, okay? So here's a word that has all three elements here, endocardium. All right, so if we break this word down, we have our same word root, heart, cardi. So then we look at the beginning of the word and we actually see the word endo. Okay, endo is a prefix, and once again, this O is not a combining vowel. It's actually part of the prefix, meaning within. Then we come to the end of the word and we see UM. UM is another word that means pertaining to. There are a lot of suffixes that mean pertaining to, and this is one of them. All right, so if we read this word or look at it, we break this word down into endo, that's our prefix, cardi is the word root, and then um is the suffix. We don't need an O here because this suffix begins with a vowel, and so the word is not endocardium, okay? We don't need the O, we just attach that suffix directly onto the word root, and we get the word endocardium. So a question, the meaning of the prefixes and suffixes never changes, but both change the meaning of the word root, okay? So what the thing to look at is when you put these together, the word root itself doesn't change, but the overall meaning of the word will change, okay? And sometimes it's as simple as changing it from a noun to an adjective, or even changing something from being positive to negative, okay? There's a lot of words that mean no, not, or have a negative connotation. It can actually change the meaning of that word. Okay. So let's just review real quickly the word structure and some of the elements. So as a review, the prefix is always placed at the beginning of the word. Suffix is always placed at the end of the word. Combining forms are used when a word has more than one word root, okay? But when we do that, we actually get something called a compound word, and we need to make sure that we put an O between those two word roots as we're sticking them together or placing them together. And then we'll use our combining vowel after the last word root if we have a suffix that begins with a consonant. If that suffix begins with a vowel, then we don't need the combining vowel at that point, okay? So here is an example of a combining word, leukocytosis, okay, or a compound word. All right, so there are two word roots here, leuc and cyte, okay? Leuc is white and cyte means cell, okay? So leukocytosis actually means an abnormal condition where the white blood cells are elevated in the blood, okay? Osis is condition or blood condition. Okay, so here's our combining form here. When we come over here and look at cyte, we wouldn't do leukocytosis. We don't need that combining vowel here because osis starts with an O, which is a vowel. Okay, so the word is leukocytosis. So this is a common way that we put these compound words together. We have a combining form, we have a word root, and then we add our suffix. Okay, if this suffix were different, let's say this suffix began with a consonant. So there's a word, there's a noun or a suffix ending called penia, P-E-N-I-A, and that means lack of or deficiency of. And so if we put that term here instead of osis, we would have leukocytopenia. Now in that case, we would have to put the O because our suffix began with a consonant. So this O will be used if the suffix or the combining vowel here will be used if the suffix begins with a consonant, okay? All right, so another thing that we have to look at too is how we read these words, okay? It's important to realize that there's a certain way to read them, and you can see where if you mix up the order that it changes what you're saying, okay? So when we look at defining a medical term, we always start with the suffix first, and then we're going to go to the beginning and we read from we go from right to left, okay? So we start with the suffix, then we go back to the beginning of the word and then go with prefix and word root, okay? So if we look at the word carditis, the suffix here is inflammation. Itis, I-T-I-S, means inflammation, and we have our same word root. Okay, now this is kind of an exception to our rule as far as adding that combining vowel, because here we have carditis, and we can't, if we kept that combining I there or put an O, we would have cardioitis. And so that's not the correct way to say this word. And so this is one of the rare instances where we kind of drop the I and drop the O and just kind of tag the suffix onto this word root because it begins with an I, okay? So here we have the suffix itis, the word root cardi or card. And so when you read this word, we start with the suffix and then move to the beginning of the word. So this word is inflammation of the heart, okay? You could say heart inflammation, but that's not prototypically what they do. They always say the suffix first and then go to the prefix and then read the word root, okay? So when we do the order of these, we start with the suffix and then we go to the prefix second and then the word root is last. If the word doesn't have a prefix, then you read the suffix first and the word is still last or second, however you want to look at it. So here's another example, intracardiac, okay? So AC is our suffix, which means pertaining to. Then we have a new prefix here called intra. Intra means within. And sometimes you'll find that some prefixes, multiple prefixes can mean the same thing. Indo also means within. So both of these prefixes mean within. We have our same root word. So as we read this word, we're going to say pertaining to within the heart. Okay, so you can see how we started with the suffix, we then moved to the prefix, and then we read the word root. Now, one other small little caveat as well, when we're looking at medical words that actually identify or involve body system or organ systems, generally you're going to define the body system that you actually study first. Now, this is kind of silly because if somebody hasn't taken the course, and some books are different, but generally you're going to mention the body organ system or the body organ that you study first as you're going through a book, okay? And so we have a number of words that can go together. We can mix the heart and the lungs together, cardiopulmonary. We can mix the heart and the vessels together, which gives us the cardiovascular system. You can mix the stomach and the intestines together and get the gastrointestinal system. And so it's important to realize that as you're studying those things, the heart comes first, then you study either the vessels or then the lungs, and oftentimes when you're studying the digestive system, you study the stomach first, and then you go to the intestines. If you were having digestive issues, you wouldn't say, oh, I'm going to go to the intestinal gastrologist, okay? We say gastroenterologist. If we're going to go see somebody for our heart and lungs, then we're going to go see the cardiopulmonary specialist. If we have issues with our heart and our vessels, then we're going to go see a cardiovascular specialist. So as we put those word roots together, it's generally done in sort of a logical order that we would study if we were looking at a book. All right, so here's the example, cardiopulmonary. ARY is another one of our famous suffixes that means pertaining to. We have to put our combining vowel here. So we have two body systems, the heart, and then we have the lungs. Pulmono or pulmo means lungs. So in this case, the O here is present in our combining vowel because we have to have the two linked together. Now, if you come over here, our suffix here is airy, okay? And so because it begins with an A, we just tack it right on to the other word root, pulmon, and we get cardiopulmonary. Okay, we don't need the O, it wouldn't be pulmonoary. Okay, and that means pertaining to the heart and lungs. Okay, so let's look at our order. This question's just referring to what we've gone through, and we're looking at a word that has all three word element or word components. What order do you read them in? So the correct is suffix, prefix, word root, which is letter D. Okay, so that kind of gives some of the basic rules as far as putting words together and how to pronounce them. We also have pronunciation or phonetic guidelines that are present too, and a lot of these follow the English language, and some of it might be things that are already inherent. If you've studied English, they're already kind of inherently in your brain, and you already kind of naturally do it. But there's a few here that might help you out because a couple seem a little bit harder to remember or pinpoint. Okay, so I will go through and just kind of talk about these. So when we're looking at the letter F, that F sound has a F sound. But two other letters that produce the same phonetic F sound are PH. So we're looking at the word physiology or pharmacology. That PH sound has the same sound as the F sound. Okay. Now the other thing to realize with these sounds too is that you're not really going to be quizzed on this per se. I can't, we're not doing any kind of, oral presentation where we're you're getting graded on these sounds. But as you go through, it's important to be able to pronunciate these things correctly, because once you get into the field and start talking with people and talking, with pharmacists and doctors, it's important to say things correctly. So that's why this does come into view, even though you're not directly being tested on it for this class. Okay. So we already talked about F. If we have a sound, we're looking at the J sound. It could be a straight J. That word is jejunum right here. That's the second part of the small intestines. But there's three other phonemes that actually have the same sound as well. So if we have GE, GI, and GY, all of those have that soft G sound or the J sound. Okay, so here we have jejunum. When we have GE, that word would be genesis, not genesis. GI is gingivitis, not gingivitis or gingivitis. And then GY is gyrus, not gyrus. Okay, so that these three letters right behind the G gives it that soft J sound. So then we have the K sound, the K sound. And so there's a couple of other sounds that are the hard K sound as well. So here we have kyphosis. So kyphosis is an abnormal curvature of the upper part of the spine that happens with osteoporotic patients. It's also called a humpback. This word is just straight C. When we have C with an O behind it, you get that hard sound cornea. So cornea is part of the eye. And then CH, that's not a ch sound, that's actually the hard K sound, that's a chorion. And then this is a little bit odd, but this is quadruplet, so it kind of has that QU has that K sound as well. We have a couple of sounds that sound like N. And for neonatal, that's the first 28 to 30 days of someone's life. They're in the neonatal period. PN, these are kind of common ones that we all know. PN is pneumonia, and KN is knee. Those are silent, obviously. When we're looking at the soft S sound, we have a couple of other letters that sound like that too. Sarcoma is a type of tissue tumor. C by itself also has that soft S sound, cervix. Okay, cervix is the front part of the neck part of the uterus. And then we put PS together, we get psychology. Okay, has that soft S sound as well. Then if we take S and put another pronunciate or put a K in front of it, then we get the sound SK. So we have skeleton. Then we also have SC, which gives us that same sound, sclera, which is the white part of the eye. And then if you actually put an H in front of the C, we get SCH, that's schizophrenia. Okay, so all of those have that hard S, that SK sound. Z, we all know that that X sounds like Z often. So here we have zygomatic, that's part of the cheek. And so you would pronounce this xanthoma. Okay, xanth means fatty or yellow, and oma means tumor. Okay, so that's like a yellowish kind of tumor, but it's pronounced xanthoma. Okay, so a couple of additional ones. These are a little bit less. These are a little bit of a good reminder, a little bit less obvious than some of the other ones that we passed already. If you have a C that is followed by E, I, or Y, we kind of said that already, it has the soft S sound. Cervix, circumduction, and cyst. Okay. However, if you put A, O, or U in front of it, or a consonant, then you actually get the hard C sound, which has a K sound. Okay. Examples of that are CA, cancer, CO, collagen, CU, cuticle, and the CH is also, that's a consonant, so that's cheloplasty. That's actually having surgical repair of the lip, okay? So all of these have that har say. It isn't sensor, sologen, ceuticle, and chelioplasty, okay? So these particular ones give the C a hard or K sound, okay? This is a little bit less intuitive as well. If we have a G that is at the end of a word root, okay, and that G is followed by an E or an I, then you're going to pronounce it as the soft G which is actually the J sound. Okay, so an example here is this G right here. So this word is laryngectomy. Okay, this is a removal of the vocal cords. Okay, or the voice box. Okay, it's not laryngectomy. Come down here and we have the word pharyngitis. Okay, so this G is followed by an I, and so it's not laryngitis, it's laryngitis. Now, if we take that G at the end of a word root and put a O or a consonant next to it, then we get the hard G sound, which is a G sound. So these words are a little different. This is laryngalgia. So this is a special word because it's got the J sound here, and then the hard, it's got the hard G sound here, and then the soft G sound here. So it's laryngalgia. Okay. It isn't laryngalgia. Here we have one G. This is a meningocele. It isn't a meningocele. Okay. However, a meningocele comes from the meninges, and so even some words can be pronounced differently depending on what suffix or vowel is attached to it. So this is a meningocele, but meningoceles originate from the meninges. Okay. True or false? Thankfully, a medical term is spelled just like it sounds, and obviously we just found out that that is totally false. Okay, so it's really important to study and get a good idea of these pronunciation guidelines. Once again, you are not being tested on this in this class, but as you go forward in your healthcare career, you're going to want to make sure that you're pronouncing these things correctly. And so having these rules embedded will help you out. All right, and one last little thing is something called an eponym. And an eponym is a possessive form for names that are actually involving diseases or organs that are named after an individual. Okay, and so it's called the possessive form. And it just basically means that a disease or an organ or a procedure that is derived from a person's name. Okay. And so here, probably the most common one of these is Parkinson's. You can find quite a few, but I think people have heard of Parkinson's disease. It's named after James Parkinson. A few others are Lou Gehrig's disease. That was named after the person, not that invented it, but had it, or it was first documented. Huntington's chorea, Turner's syndrome. These are all possessive forms of some form of a name that is used to represent that particular disease process. Okay, so that's called an eponym. Okay, so that kind of ends this particular slideshow, and so there'll be one on each system from here on out. So please make sure that you go through the book, look through all the rules, start looking at some of the word roots, and as you go into chapter 2 and start getting into the prefixes, going through and memorizing all of these prefixes will be important. Okay, and if there's more than one, it's really important to make sure that you try to memorize all of them because they usually come back in some way, shape, or form. Okay? All right, take care, and I'll see you in the next video.